Tonight, sadly, our aged care sector is in a real crisis. This is now not just a rhetorical issue. Shortages of staff has meant that many of those who stay at home and are told they are going to receive staying at home packages actually can't get what they need. Those who lose the physical and or mental capacity to stay at home are recommended by their doctor for aged care nursing homes. It's not a lifestyle choice, it's a medical decision. Nursing homes, they're in a real crisis with reports today that 7 out of 10 are unprofitable. The crisis is deep, it's getting deeper, and for a start, an ageing population and a declining workforce means we're running out of resources, cash and workers. Senator Anne Ruston is the Shadow Minister for Health and Aged Care. She's joining me right now. Happy New Year to you, Senator. This is a big crisis. There's no quick fix for this issue, though.
No, there is no quick fix. And, you know, we acknowledge that there have been some challenges in the aged care sector for a very long time. That was why the previous coalition government put in place the Royal Commission into aged care. But the thing that is really, really concerning is the current government came into government on the promise of some significant changes to aged care, and so far all we seem to have seen is the situation get worse. And today's report, as you've just mentioned, Gary, just shows that the deterioration in the aged care sector since this government has been here. You know, there's some serious questions about the fact that they've gone out with a few headlines, but they're not terribly good at delivering on their promises.
Well, they've got a lot of work to do because I think a lot of Australians, you and I have talked about this before, are job snobs. They don't want to clean up after others. You know, and it really does take a special kind of person, a caring person, to want to work in this sector, either in institutional aged care or providing those stay-at-home packages.
Look, we have to absolutely acknowledge that the work that our aged care providers and the people that work in aged care do is absolutely fantastic. They are an amazing group of people and we should absolutely thank them for that. But the challenge that we have at the moment is that we know that we've got some significant workforce shortages out there. But this government has gone and made all these promises about 24/7 nurses in aged care. They've made promises about the number of care minutes. But they know that they've got the workforce shortages are going to preclude them, aged care facilities, being able to meet these requirements. And what does that ultimately mean? It means that potentially aged care facilities are going to have to shut. And where does that leave our older Australians?
Well, I think that's right. I mean, money won't fix it. State governments, they're not helping either because they're throwing taxpayer money to try and attract people to various hospital services that they're promising. And in regional Australia, it's only worse and worse and worse than anywhere else. I mean, you come from the regions, you understand that. There's just only so many healthcare workers around.
Yeah, look, absolutely. And I mean, nobody in Australia wants to see our older Australians in their journey of ageing not getting the support that they deserve. You know, I absolutely would love to see, you know, everything that the Aged Care Royal Commission wanted for older Australians to be able to be delivered. But the reality is that, you know, you have to work with the situation, the circumstances that are before you, and simply making headline promises that older Australians are going to get all of these things that are absolutely not deliverable, I think is an unconscionable thing for a government to be doing.
Yeah, I think we want some honesty there. Well, how do we get younger Australians interested in working in this sector?
Well, I think what we have to do is we actually have to recognise the marvellous career opportunities that are there. But if we continue to put the kind of pressure that we are on the sector by making all of these demands, like you know, bringing forward the recommendations of the Royal Commission, knowing that they can't be delivered, it just continues to put you know, the negative pressure on. We know that our hard-working aged care workforce has been under extraordinary pressure during COVID. And, you know, there are a whole heap of factors that keep adding into this. And the government just keeps on admiring the problem and not providing any solutions. And I think, you know, with the pressures that we have at the moment, we actually have to sit down and have an honest conversation about how we're going to move forward and make the changes that we need to make, instead of just going out there and saying whatever we like and to hell with the consequences. I mean, it really is very distressing for older Australians to be made promises that they're never, ever going to be able to be kept.
You're right, at the boardroom level, a lot of these aged care providers are going to be saying it's all too hard, so we're better off denying the risk possibility and just walking away from it. It seems to my mind that families are just going to have to do a whole lot more. They're not going to be able to leave it for others. Families are just going to have to dig deep. Maybe intergenerational living might become more of a norm in Australia?
Well, I mean, the big challenge that we have is that not all Australians do have a family that's able to support them in the way that you know, some of us are able to do. And so we have to recognise that there will be Australians who are going to have to rely on an aged care service to support them. And the problem, of course, is that unless we can maintain the sustainability of our aged care sector going forward, unless this government can come up with a plan that shows how that's going to be able to be achieved, you know, we really are being left in the dark. And you know, it is absolutely essential that aged care is sustainable into the future, because it's not just this generation, it's subsequent generations, you know, into the future. We want to make sure that there is an aged care support sector out there to be able to support all Australians forever.
Yeah, because, well, frankly, we're all ageing right now, aren't we? Every moment goes by, we need people to pay taxes to pay for a lot of these things. I can see a future of a lot of granny flats and multi-generational living myself. But look, I notice you're wearing pink. I've got a bit of pink on. Of course, it's been more red-faced than pink-faced at the cricket today in Sydney with the weather the way it is. But I take it with Jane McGrath Day tomorrow, you're going to be there?
Well, it was the Jane McGrath Day today, but because of the rain, most of the entertainment has actually been postponed until tomorrow. But, you know, a great shout out to the Jane McGrath Foundation. They've raised millions of dollars today. But for anybody who can't get to the cricket tomorrow, you can always buy a virtual seat. Go online at the Jane McGrath Foundation, pay your $20, and hopefully we can sell out a few stadiums and make a huge amount of money for the breast care nurses that support so many Australian women who are going through breast cancer.
And you know, what's so great about what the Jane McGrath Foundation does is it's not government, it's actually people who've put this organisation together to make a difference. You know, full points to them and everything that they've been doing for a long, long time now. Anne Ruston, great to see you always, and we'll look forward to talking to you again about this dreadful problem in our aged care sector. Thanks for your time.